recording, just so we can have this for the producer portal. Ensure that for those folks that weren't able to join today, they have access to the materials. Again, I will just want to take a minute, thank everybody. I know it's a busy time for everybody leading into open enrollment, so appreciate you taking a few minutes out of your day to participate in our webinar today. As the email mentioned, really what we're going to do today is focus a little bit less on the background of the products, although we will do a review of each of the products that are available through Liferaft, but really start to put the products into context and the application of them as you think about where the value may lie for your customers. And for each of the products, we're going to walk through a case study that actually looks at real numbers of how our products can be valuable for your customers. One just kind of housekeeping item before we get started here. If you have any questions, I've got both the chat and the Q&A up. Please feel free to drop any questions that you have into either the chat or that Q&A, and I will be sure to answer those as we're going through the slides. So with that, let's go ahead and get started. As I mentioned, today we're going to spend most of our time talking about the actual application of the Liferaft products. But I wanted to start with a very quick review of what the products actually are and at a high level where we think the value lies. So as many of you are familiar, we really have three what I call serious medical event solutions available on our platform today. There is the accident supplement, the hospital supplement, and the critical illness supplement. And really each of these products are designed to help fill a gap that most of your clients likely have, especially if they're on those lower tier major medical plans or potentially don't even have major medical coverage. And so as we head into open enrollment season, and for those of you that are active in open enrollment, you're likely going to be either reviewing the enrollment and the major medical plan that one of your clients already has, or you're going to be helping new clients with major medical coverage. And so one of kind of the key things to think about here is even with major medical, are there key areas of risk and exposure that a customer is going to have? And the short answer is yes. Anytime you walk through any major medical plan, whether it's a bronze up to a platinum level plan, there is always going to be a component of the cost share that your client is going to bear. And so for folks, especially on the lower end of those metal tiers, that cost sharing responsibility is quite high for our customer. And if our customers are trying to keep their cash flow as low as possible and maybe don't necessarily have a ton of liquid savings to help meet a big hospital bill or a bill required if they need any sort of health coverage, then the implication of that is they could be put into a pretty difficult financial position, right? As a reminder, one of the things that we're really tackling at Liferaft is helping reduce medical debt, right? Medical debt is one of the leading causes of financial bankruptcy in the US. And part of the reason is people either don't understand their major medical coverage or because they can only afford to or getting the minimum level of coverage. And while they have coverage, if something bad ends up happening, they are left with a pretty large bill that they have a hard time paying. And so the value in supplementary products that are simple, easy to understand, and affordable is really to help fill those areas where your customer is going to have a significant financial exposure. So starting with the accident plan, as a reminder, this product that we have is offered through Liberty Mutual. It is really a reimbursement indemnity. So if there are expenses that your client has related to an injury that results from an accident, whether that's falling in the bathtub or a car accident or kids playing sports, this product is going to help cover and reimburse any out-of-pocket expenses that your client has up to a cap. Now, that product also includes an AD&D rider. So as we think about different use cases, I think that that value is an additional benefit that your clients can benefit from as they think about the accident plan. Now, the hospital plan is also an indemnity. All of our products are indemnity based. That product is going to offer a daily cash benefit. So thinking about this product, the value really is going to be helping reduce that out-of-pocket cost that is associated with a prolonged hospitalization, right? I'll give everybody an example here. And this isn't even a high deductible health plan. I was talking to a friend of mine who works for the federal government, and they have a really great plan with Aetna through the federal government, super low copays, pretty low deductible, actually a $0 deductible, and about a $6,000 max out of pocket. And most everything is covered 100%, except for co-insurance on hospitalization, right? Now, as I walked through the plan with this friend of mine, they had no idea that a 3-day hospital stay could result in a $6,000 bill for them. And so there are a lot of these, I think, that's a very, very good in air quotes plan that still leaves a significant amount of cost or exposure to the end consumer. And so the hospital plan is really is designed to help cover those costs related to prolonged hospitalizations. Now, the third product is the critical illness supplement. And when we think about the critical illness supplement, that product is designed to offer a lump sum indemnity, right? So slightly different than the first two products, but is going to offer a lump sum of cash to your customer or your client if they are diagnosed with a critical illness. And when we think about critical illness, what usually ends up happening is if somebody is diagnosed with cancer, for example, they are almost certainly going to be hitting that out-of-pocket max on their major medical plan for at least the first 2 years after a diagnosis. And so can we help reduce that exposure and cover that out-of-pocket cost with a payout from a critical illness supplement? So let's go ahead and jump into each of these products one by one. I'll spend a couple of minutes talking about the product details that we have available, and then we'll look at the case study of the actual use for the product. So starting with hospital supplement, the case study that we're going to talk about is really focused on this AIG product, but I do want to remind folks that are appointed with us, and there may be some new folks on our call today, that there are two options available today, depending on the state that you're based in. Now, AIG, I should mention before I start, all of the products that Liferaft is going to offer are guaranteed issue products, right? So no medical underwriting, no medical questions are asked during the application process. It takes 2 to 3 minutes to bind a policy. With the hospital plan for AIG, that product is guaranteed issue. It is age rated, so the price will depend on the age of the primary policyholder or primary insured at the time of purchase. And it is available for people that are 18 to 60 years old. Now, the AIG product will offer a daily cash benefit that is flat throughout the hospitalization, either $200, $350, or $500 per day for every day of hospitalization. With the Liberty Mutual product, that is also guaranteed issue. That is not age rated. So that product is flat pricing for anybody that is 18 to 65 years old, but the structure is a little bit different than AIG. The structure is a one-time admission fee, which is paid on the first day of hospitalization, $500, and then $100 per day for the confinement. So $500 on the first day, $100 every day thereafter. Now, those are a very high level kind of basic overview of the two products that are available. If you'd like more detail on this, if our team hasn't already, we will be posting a webinar that we did last week that really dives into the nitty gritty details for each of these products, everything from the admission cap to how pre-ex are handled, to what the pricing actually looks like. So if you haven't had a chance, you can check that webinar out. You'll get a lot more detail on each of these products, but I did just want to provide a very quick overview. Now, we're going to, as I mentioned, talk about the AIG product in practice and what that looks like for a client. So for each of our scenarios, we're looking at somebody that is 35 years old and has a bronze level plan, and makes about $75,000 a year. Now, the pricing that we're using in our scenarios is the average of the bronze level plans that are available in the state of Texas. Now, one thing I will say is if you are offering major medical, one thing that we can do, and a lot of our agents have found helpful, is create custom collateral for you that includes the ability to fill in the quote details for your major medical. If you have top selling plans that you are offering to many of your customers on the major medical side, simply send us the details of which company and which plans. We will put together collateral where rather than having to offer your customer one quote sheet and one kind of flyer that markets the major medical, you can also offer Liferaft right next to it. So you don't have to do two separate flyers and two separate quotes. We'll combine everything for you. But I bring that up to as we head into our hospital supplement in action. So again, when we think about the value of the hospital plan, right, and how clients are thinking about the major medical options that are available to them today, oftentimes it's going to be, do I take the bronze level plan or do I go with a silver level plan, right? Oftentimes the next cheapest, or for here, and for this example, we've used the average cost, but also the average kind of deductible and max out-of-pocket features for plans. Now, if we have a client that has a bronze level plan, a 3-day hospital stay, a 4-day hospital stay, and these numbers are actually for Texas for our examples, but a 4-day hospital stay in the state of Texas is going to cost, on a gross basis, $10,652, right? Now, not all of that is a responsibility of the client, but if they're in the hospital for 4 days, the insurance plan is going to get a bill for about $10,000, a little over $10,500, right? Now, if I'm a client that has a bronze level plan, my deductible is $57.84 and my max out of pocket is $62.95. Now, given those plan details and that plan design, if my hospital bill is $10,652, I'm going to be responsible for my full out-of-pocket costs. And that's $62.95, right? Now I'm paying $279 a month of premiums. And if I or somebody in my family is in the hospital for 4 days, I'm going to have to fork over another $62.95 to help cover the cost there. Now, that's option one. Option number two is I go ahead and upgrade and pay more in monthly premium to buy a silver level plan and hopefully reduce that out-of-pocket cost. And in the second table here, silver only, you can see that that is what happens, right? The cost of my hospital stay is still the same at a gross level. What is billed to my insurance will be the same. However, my out-of-pocket cost now is $44.46, right? So my component of that cost is a little over $4,000. But to get that cost saving, I am now paying about $120, $130 more per month of premium to get that silver level plan. But there's a third option that's available here as we think about, okay, if our goal is helping clients manage cash flow, but also helping give them the best coverage available to reduce that out-of-pocket exposure that they have, then we can look at a pairing of a bronze level plan and a Liferaft premium, in this case, with AIG, right? So the premium level plan with AIG will pay $500 per day for a hospitalization. So in this case, I'm a client that has that bronze level plan. That cost of the hospital stay is still $10,652. I am still responsible for the $6,295 of the out-of-pocket cost. However, the AIG policy through Liferaft is going to pay me $2,000 because I've been in the hospital for 4 days. That's 2,500 times 4. That gives me $2,000. Now, given that, my net cost now of that 4-day hospitalization was actually $4,295, right? It's a $6,295 less the $2,000 payout. And my monthly premium is my $279 for my bronze plan plus about $20 a month, a little less than $20 a month for the AIG hospitalization. And so what have we really been able to do here is, one, when I think about and look at this option versus the silver level plan, right? We've actually reduced the total out-of-pocket exposure to a level that is below the silver plan, but we've done it by only increasing monthly premiums to $20. So if you're talking to a client and offering them a solution, you are helping reduce that monthly cash flow, that monthly premium that they're paying compared to the silver, but you've actually given them better coverage, right? Now, as we think about heading into open enrollment, I think what a lot of us are seeing is that subsidies are probably going to continue to be fairly rich, which means we're likely going to be looking at putting more of our clients into silver level plans because of the subsidies that are available. But that being said, I think this argument and these plan dynamics are still going to hold, where if your client has more cash flow available because they're getting a richer subsidy, they can actually get better coverage when we compare a silver to a gold. And so that's really, I think, how we highlight and we think about the real value for our customers with the hospital plan when you look at the numbers in action. I will pause there in the event that anybody has any questions. Again, feel free to drop those into the chat or to the Q&A. If there aren't any questions, and I'll give it just a minute here, we'll move on to the next product and the next case study. Great. Doesn't look like there are any questions. So let's talk about critical illness. Now with critical illness, the focus of our case study is going to be the Liberty Mutual product. Again, we have two options available here. There is an AIG product available as well as Liberty Mutual. However, I should mention the AIG product is only going to be available in the state of Florida. So I won't spend much time covering that. I want to talk about Liberty Mutual. Now, the Liberty product for critical illness, again, guaranteed issue, right? All of our products are going to be guaranteed issue. And this product is age and tobacco usage rated. With Liberty, we are going to cover, right, the illnesses that are covered. It's comprehensive. It covers cancer diagnoses. It's going to cover cardiovascular health. So that means heart attack, stroke, coronary bypass. It's also going to cover organ transplant, and it's also going to cover renal failure. Now, this product is available for folks that are 18 and actually issue ages of 18 to 65 with a policy termination of 70 years old. And this is really designed to offer that lump sum indemnity upon a diagnosis, right? So you have clients that receive a cancer diagnosis, they file a claim, what they're going to receive is a lump sum payout. Now with Liberty, there are 3 tiers of coverage. There is $10,000, there's $20,000, and there's a $30,000 option that is available. As I think about the value and the use case here, right? As I discussed a little bit before, when somebody receives a critical illness diagnosis, particularly cancer, which is the example we're going to look at, there is a cost associated with that cancer treatment for the first usually 2 years. And that cost is going to be so high that your client is likely going to be responsible for 100% of their out-of-pocket max for at least those first 2 years. And so with our lump sum indemnity, can we help cover the out-of-pocket exposure that would be associated with a critical illness diagnosis, right? And so let's go ahead and jump in. We're looking at the bronze level, although again, this actually gets more attractive, I would say, as you look at silver level plans where that max out of pocket may come down. But really, if we have the same plan details, right? Deductible of $57.84, max out of pocket of $62.95 in the US today. If somebody is diagnosed with lung cancer, which we use in our example, although the number is quite similar for many metastatic diagnoses, you're looking at a gross cost of treatment of $140,000 for those 2 years, right? So $70,000 roughly per year. That means for your client, the 2-year expense for those 2 years of treatment is going to be $12,590, right? It is their max out of pocket, the $62.95 times 2. They're going to have 2 years of that. Now they're paying that monthly premium again of $279. So can we take the bronze level plan and add the Liferaft critical supplement to it and see what happens to our monthly premium, but also what ends up happening in terms of the cash flow that is available to our client. So plan dynamics and details are the same. I am still responsible as a client for $12,590 of out-of-pocket spend. But if we give them the middle tier, which is the $20,000, now again, this is for, I should mention, a 35-year-old non-smoker. If we offer them the critical illness or the critical supplement payout of $20,000, what does their actual expense end up being? It's actually a net cash positive for your client of $7,410, right? So said differently, if I'm responsible for $12,590, that's my spend, but I'm receiving 20, I actually have been able to cover that full max out of pocket expense for those 2 years, but I also have some money left over for additional spend that I may have, whether it's traveling to get a second opinion from MD Anderson down in Texas or the Mayo Clinic, or any other expenses that are going to be associated or not associated, frankly. It could be childcare, it could be anything. I'm going to have additional cash left over. And so one way to think about this, right? I have a line here, years of MOOP covered, is a rule of thumb we can think about is if you have clients that have, let's say, a max out of pocket exposure of $5,000, what we may want to do is use a rule of thumb of covering 2 years of the out of pocket exposure. And so even at the $10,000 level, what you're doing is effectively helping your client cover those first 2 years of treatment after a critical illness diagnosis. Now, with the 20,000 benefit on the bronze level plan here, we're actually covering we're covering 3.2 years of the max out of pocket. And so that really means, we're covering those 2 years and then we're giving folks additional cash flow because, if we really think about it, the treatment is expensive, but there are a lot of other costs that are going to be associated with the treatment, but then also recovering from a critical illness diagnosis. Now, I think what's really interesting here is our monthly premium, again, is only going up. It's going up less than $20 a month, right? So you're offering your client and you're really shoring up their coverage on that out-of-pocket exposure, and you're doing it for less than $20 a month. So again, I'll pause here for just a moment. In the event there are any questions, please feel free to drop it in the chat or to the Q&A before I move on to the last case study that we have. Great. Doesn't look like any questions. So let's go ahead and jump into the accidental medical expense. Now, the accident supplement, a couple of things I want to mention on this product before we jump into the case study. One, again, guaranteed issue product. Um, with this product, there is no age rating. So it is flat pricing and there is no issue age cap. So there is a broad level of application with our accident plan for folks that are buying off the exchange, or even for folks, for the agents that we have on the call that have a Medicare component to their book. This product is available for the Medicare market because there is no issue age cap. Now, the accident plan, there are 4 tiers of coverage here. And the way the product works is it is a reimbursement indemnity for those costs that your client is going to be responsible for relating to an injury that results from an accident, right? So what we're going to look at is an example of somebody that is in a car accident and breaks their femur, and that femur and that accident requires a ambulance ride to the emergency room, emergency room treatment and diagnosis. It requires surgery for that broken femur, and then it requires a hospital stay to recover, and then it requires follow-up imaging and physician office visits and physical therapy, right? Your client, again, is going to be responsible for some portion of costs. And with the AME product, there is going to be a reimbursement for their share of costs associated with this accident or this injury. Now, I think the key thing with the accident plan is that it is incredibly comprehensive in what it covers. And as you can see on this slide, there are a list of inpatient and outpatient benefits. So when we look at this product in application, if you look at the cost of a femur break, that requires a good amount of inpatient and outpatient treatment. If, again, you have a client that is on a bronze ACA plan with that max out of pocket of $62.95, and we're going to go ahead and assume that all of this treatment occurs in one plan year, the cost of that femur break can be as high as about $35,000 total that's going to get billed to insurance. Now, if that is the cost, I am going to be responsible for $62.95 of that $35,000 bill. Now, if I had the Liferaft accident supplement, what does my exposure go to? Because it is a reimbursement indemnity and your client is paying for $62.95 of that care, you have effectively reduced their exposure or their cost of care for the client to zero, because they are going to get the entirety of the $62.95 from the payout on the accident supplement. And so with and what we've done here is look at the $7,500 AME plan. And the way I would think about what level of AME is right for my client base is to look at, like we have here, that max out-of-pocket exposure that your clients are going to have, and look at an AME plan that is either, if they can afford it, 100 or a little more than 100% of it. But really, I think is close to 100% of that out-of-pocket cost when I look at these AME benefits. So we looked at the premium coverage for clients, which offers $7,500 of care for our client here that has a bronze level ACA plan. And we have been able, again, to reduce that total cost of care to $0 for your client. And again, the cost of this plan is $1,161, right? So we have only increased their premium about $11 a month and really helped reduce and pretty much eliminate their exposure for any treatment related to an accident that leads to an injury. And the definition or the accidents that are covered here for those folks, again, that have a Medicare book, think about even if a client falls and has an accident, that would be covered here, right? Car accidents, This is great for folks that have young kids that are active. Young kids that are playing sports are often injured and need to go to the ER. Those are all instances of accidents that would be covered with the accident supplement. So that's really how to think about each of these products. And we wanted to put it into real case studies with real numbers that help illuminate where the value for these products lie. I think the key takeaway here is as we're thinking about major medical, helping our clients understand that major medical coverage is important, but it leaves you open to certain types of risk, which can be very costly. And we can design a portfolio of products that sit with your major medical and work alongside it to help reduce the ultimate financial exposure or that bill you're going to have to pay if something happens to you and you have to be a heavy user of your major medical, right? And each of these products is, as you remember, as we went through, for somebody that's 35 years old, the total cost of adding this entire set of products was just under about $40 a month, right? So even if I'm paying $279 of major medical premium, if I add $40, that's $319. That is my fully loaded monthly premium. And if you guys remember from the very first case study, the average cost of that silver level plan is $408, right? So we've increased our premium by $40, which means we've still saved them about $90 a month, but we've also helped reduce that out-of-pocket exposure substantially for the 3 instances in which they are certain to hit their out-of-pocket cost. And so we're both saving our client money on the monthly premium, but we're also providing them better coverage as we think about the options that are available to them. The last thing I'll mention here that I did mention earlier, but as a reminder, if you are selling, if you are going to be selling major medical during open enrollment, please do reach out and let us know which plans you most frequently offer, because we will create custom collateral for you where if you're going into a client meeting or you're emailing your client a quote, we all know the more information you send a client, the more overwhelming the decision feels, the harder it gets for us to be able to offer them good products and frankly, to make that ultimate sale. We will help simplify that by creating one PDF. You can offer your major medical plan that you think is right for your client right next to the Liferaft supplementary product set in one PDF that is simple to understand. It's easy to understand. It's easy to see what their net cost is going to be, rather than having to send them a bunch of information, which is going to make that sale much harder. So again, if you have plans that you're offering, please let us know. We will be happy to put that collateral together for you. And that's all I've got for today. Appreciate again everybody joining. I will open it up to questions now. Again, please drop those into chat or the Q&A. Happy to answer any questions that folks have. And I'll stick around for a few minutes to help answer any of those questions. All right. Well, doesn't look like we've got any questions at this point. So again, appreciate everybody taking the time to join us today. We hope you found the webinar valuable. As I mentioned, we have recorded the session. We will go ahead and put this into the producer portal. If you haven't yet, check out the webinar we did last week, which walks through the products in a lot of detail. and then also includes a section we did on how to actually place business. If you can't find it, let me know, and our team will be able to help point you to the right recording there. And with that, thanks everybody. Really appreciate